if you could just touch on why early childhood intervention is so different to the rest of the sector, please.
Yeah, sure. So this is a question that's been asked quite a bit, and obviously components of your business transition to the NDIS are similar across the age groups. But there's two issues that are sort of intertwined that I'll give an example of, and one of those is an issue that we're advocating for continuously, and that's challenge around cancellations and no-shows for families. The response from the NDIA has always been, build it into your business model. Other businesses outside of the sector do so, which I would completely agree with in normal circumstances for typical families. But that's not always the case in early childhood, and obviously children have the added complexity of their families, what's going on for their families. Exactly right. Yeah, so an example of why it's different in early childhood, alongside the example of cancellations or no-shows, would be that if a family doesn't attend an appointment or cancels at the last minute, you've got a key worker who's got the relationship with them who's unable to go to that appointment.
Correct.
It's not possible with the key worker model, because of the relationships that staff have with families, to just send them to another family that's not their key worker. And so working out what that key worker can then do with that gap of time in the day whilst you're still paying their wages has been something that services, particularly in Barwon, have had to try and work out.
An ongoing challenge and learning, no doubt.
Yeah, it is an ongoing challenge. I mean, if we want to keep the model of practice, which is evidence-based, and we've pushed hard for it in Victoria, and it's been around for a while now and people really see the value in it, the policy needs to align with the practice.
Sure.
So if providers aren't able to claim for no-shows and cancellations over a certain amount when it's not possible or feasible to include that, it's not realistic to us that to be built into a business model when it's an ongoing thing for families. So that has been, that's an example of a difference between early transdisciplinary model is in the early years. Later on for participants, it's more one-on-one individual supports, which could be arranged in different ways. But having that whole team around the family has implications.
There's a lot more flexibility in the later years, and we know the importance of early intervention, and obviously with a young child, they do need the support of their family around them, and the key worker model there. In that it's pretty critical. So I guess the ongoing challenge on an organisational level is what we do with a staff member who has essentially been allocated a 90-minute appointment with a family, and if there is that cancellation, how we as an organisation can ensure that 90 minutes isn't being wasted on a salary.
Yeah, and in those panel discussions from the Managers Network meeting that are on our website, a couple of the providers talk about this emerging concept of donut shifts, where they've got staff working in the morning and working after school hours, because that's when families are available and when they want to engage with the service. And that it's not feasible to have staff there
just waiting around, not essentially waiting around all day, but
their families want to see them at different times. That then goes on to have implications for costings in terms of staff payments after hours, and all of that. Just want to go back a couple of steps to the no-shows and cancellations, a bit about what ECI is, some of the advocacy that we've been doing, and part of that was developing a vulnerable families package to use in the interim in trial, which is being considered by the agency currently, which would see providers being able to claim after 3 attempts to engage a family, still being able to claim for time to keep on trying, taking into consideration the challenges with engagement and responsiveness for some families in the early years. It's an overwhelming experience to start on the journey, particularly with this NDIS in flashing lights.
Yes.
So we've been doing some work around that, and really, and it always sounds really quite harsh, but and it's definitely not because of I don't think poor motives from businesses, but if you've got a family that's attending appointments, limited no-shows, cancellations, and then you've got a family that's sort of high level of complexities, number of cancellations, no-shows, and you've got a wait list and you've got one sort of spot available and both people have chosen the service, who are you going to choose? The family that's, I guess, sort of a constant income.
It's got a bit more consistency
there. Or a potential risk. And the thought of having, you know, vulnerable families seen as risks and sort of bad business decisions in a way is hugely concerning.
Correct.
And
we
so
need to get away from that.
Absolutely. And so that's something that we are really committed to addressing. Yeah.
And helping the vulnerable families and making sure that they're not seen as a business risk and a financial liability to an organisation.
Yeah.
Obviously, at the same time, whilst ensuring that our organisations are financially sustainable.
Yeah, and I guess challenging the word vulnerable as well. I mean, vulnerability for children. I mean, there's children with, you know, complex medical needs that are often in hospital. They could be in hospital for 3 months of
at
the
unexpected
year.
times.
Unexpected
as well.
times, regularly, and kids in themselves just get sick all the time anyway at childcare, and you might have brothers and sisters, so you know, mum and dad have other responsibilities as well as their own things in their own life. So again, it's the complexity of children, the way they sit within their families, that needs to be understood by the NDIA because it is unique to the rest of the scheme. It isn't just, you know, the child is reliant on the family's engagement.
Exactly right,
so the outcomes of the child is reliant on their family's engagement, and that needs to be captured in policy.
Yeah, acknowledged and understood by the NDIA for full scheme rollout under the policy.
100%, yeah.
That's a key point. Thank you very much.